Hi, and welcome to the next Pandemic Pup series of live Q&As. Today we will be discussing CBD for pets. CBD has been a growing trend in the pet industry, and we have a CBD specialist with us tonight who can help explain everything, the science behind it, and answer some questions. For those of you who don't know me or weren't here last week, my name is Kelly Cancelmo. I am the founder of the Mainline Pet Community and the Mainline Pet Group. I'm also a certified dog trainer and the owner of StayDog. Give me a shout out if you guys can hear me this time. And hopefully you can also hear Dr. Roman over here. So if you could just like us or say, we can hear you, that'd be great. I'm hoping it's fine. We seem to be testing and everything seems to be working great. So I'm gonna keep going. We're focusing the series on separation anxiety to help prevent it, treat it, and manage it. And today we're going to be discussing a holistic approach for it. So yay, we can hear CBD, and we'll cover how it can help with separation anxiety, but how it can help in a full array of different things for your pets. If this is helpful, please like it, please share it. And without further ado, I'm going to introduce Dr. Roman. And I just want to make sure that it's very clear, Dr. Roman is a medical doctor. She is an ER doctor with Einstein. She is not a veterinarian. She will not be giving any medical advice today. And she will not be talking about dosing, which is another big question that people were talking about. You should talk to your veterinarian. However, having said that, people were asking me, why are you having a human doctor and not a dog doctor? Well, it turns out that it is a federal crime for a veterinarian to recommend or prescribe CBD. They can lose their license over it. You can ask your veterinarian about CBD. However, they cannot technically recommend it. That's why people struggle in the vet world with CBD. A lot of vets don't agree with it. However, it is what it is. And thankfully, Dr. Roman can talk to us about it. Without further ado, this is Dr. Roman. Do you want to introduce yourself and tell us a little bit about how you got into this? And I am going to go ahead and start your slides as well. So just text me if you need me.
Yep. Hi, everybody. Thank you for joining me tonight. It looks like my camera's still, so hopefully you can hear me. I do come to you, as Kelly said, as an emergency room physician for humans. I am not a vet, but I have practiced emergency medicine for the past 20 years. And today I just want to share with you a bit about CBD, which is a passion of mine, and as it can apply potentially to pets, excuse me. It is anecdotal. There's not a lot of research on CBD in pets. There is some about seizures and some research about arthritis in pets, but for many of the other applications that people are finding benefits from, there really is not the research yet. And so this is just a conversation about alternative options that are supplements, they're not prescriptions. And again, we won't be talking about dosings. I can't give medical advice, but what I can do is share with you some of the information that I've obtained about humans and maybe how it can apply to our pets. So if you go to the next slide, please. So just to give you a little background about myself, I've been an osteopathic physician in the emergency room for the past 20 years. I have met many people, kind, energetic, empathetic people, mean, ungrateful, tired, sad people. And the worst of all are the vulnerable, helpless people. I have made a lot of saves and I've touched a lot of lives, but I've also been touched. And it's been hard, but it's been that much more rewarding. The hardest thing for me as a physician has been this opioid epidemic. I've been on the front lines of the opioid epidemic, and I can't even tell you how many times I've resuscitated a patient and they've come back to life with the help of my team, only to then come back in the next day in the same dire situation. So this really bothered me after so many years of trying to help and seeing this repeat pattern. I began in the face of this crisis to say, how can I make a difference? This is daunting. Next slide, please. I couldn't believe that my own medical association was approving medical marijuana. I'm a rule follower. For any of you on the call who may know me, you can attest to the fact that I'm the last person you'd ever think would be talking about CBD, marijuana, hemp, or even be a medical marijuana practitioner like I am now. However, when I took the time to understand the science, I really couldn't deny it. Now, when you don't know where you're going, all roads will get you there. Even this hanging bridge in Costa Rica got me somewhere, but I had no idea what was on the other side. And just like with cannabis medicine, I really had no idea until I braved that road and educated myself till I found the benefit it could be for myself, my patients, my family, and even my pets. Next slide, please. So as Julie Andrews said best, let's start at the very beginning. Cannabis. This was a word that would make me cringe. Everything I had ever heard about cannabis was bad. I didn't even understand that there was a difference between hemp, marijuana, and cannabis. Those words all kind of meant the same thing to me. So I really want to make sure you understand when we're having this conversation about cannabis that it is not one and the same word. So cannabis is the name of a group of plants, just like citrus is a group of plants, lemons, oranges, grapefruits, limes. They all have a similar property, and yet they're all uniquely different. Well, the same thing is true with cannabis. If you think of it, cannabis is like the mother, and she has two children, hemp and marijuana. They are very similar, just like our children have similar characteristics, and yet they are all very unique. And so please understand that when we talk about cannabis today, we are going to be mostly referring to hemp, and I'll explain the differences to you in a bit, but cannabis itself is not one and the same. Next slide. So this is the general cannabis plant that I want you to understand. This is the herbal supplement that we're discussing and suggesting may be of benefit. And the plant has many parts. So it's not just the leaves that are important that we commonly think of, but all parts of this plant. So there are waxes, there's flavonoids, there's chlorophylls. All of these parts together are what give cannabis its therapeutic effects. At the very top of this plant, you'll see something, I don't know if you can see it so well or not on this slide, but there are tiny little capsules. They're almost like those beads, like those tapioca balls that you get in the fancy drinks now. They're these balls that are filled with oils. The next slide. On the microscopic level, these oils contain or are terpenes. So terpenes was a question that came up in the discussion that Kelly and I were having. You know, people want to understand, well, what are the terpenes? What does it even mean? So these terpenes are basically in the top of the cannabis plant, just like in many other plants. And they're basically nature's aromatherapy. So you may be familiar with other forms of aromatherapy like lavender, chamomile, pine, Christmas time. The things that you smell when you walk in the street and you say, ooh, someone's smoking pot, that's the terpenes that you're smelling. And so these terpenes have therapeutic benefits in and of themselves. And when they're combined with the whole plant, give it a synergistic or more powerful effect. So just to kind of touch on other terpenes that are helpful, we have myrcene, which is in mangoes that can aid in digestion, anti-inflammatory. Camphophylline, that's in pepper, that's anti-inflammatory. So we're very familiar with aromatherapies, but maybe you didn't realize that terpenes are also in cannabis. So the next slide. So I don't know if anybody out there likes Jack Johnson, but I'm a big fan. And if you're familiar with the song Better When We're Together, that's what's happening here. So in that plant, we have all of those important parts. And when we combine the terpenes, the waxes, the flavonoids, the cannabinoids, which we're going to talk about more, the CBD, the THC, we get something that's called the entourage effect. And this is a buzzword in cannabis medicine. If you are searching online, you may see entourage effect. What it basically is like the whole is greater than the sum of its parts. And so we had 1 + 1 and we get 3. Putting all these things together, these 500 active chemical compounds that are in this plant, we get this effect that can really impact a number of different conditions. Next slide. So a friend recently asked me, and if you have bottles there with you, I encourage you to pull them out and take a look at them as we review this slide. A friend asked me, is it true that CBD really doesn't do anything without THC? It's far from the truth. And any CBD that you buy, you're going to see this designation on there: full spectrum, broad spectrum, and CBD isolate. So I really want to explain this to you and break it down for you as simply as I can. So what I like to describe is if you're making a cake, the first ingredient you're going to put in that cake, in the bowl, maybe is the flour. That's like CBD isolate, okay? CBD is a chemical compound that comes from that plant. And when we purify it and extract it from the plant, and we put nothing in the bottle except for CBD, nothing in that bowl for the cake except for flour, that's CBD isolate. And that's 99.9% CBD. The next level up is called broad spectrum. Now, what's in broad spectrum? In broad spectrum, we have cannabinoids, and there's over 80 of them, maybe even 100 cannabinoids. The ones that are real famous are CBD and THC. But we also have terpenes in broad spectrum. So broad spectrum specifically has the cannabinoids, CBD, and all the versions of that without the THC. So the THC is removed in a broad spectrum product, and they still stick in the terpenes there to give you that entourage effect. Broad spectrum is like you added maybe the sugar to your cake, okay? You added that next level to the flour. Broad spectrum, if you remember, B is for broad and B is for brain. So broad spectrum products without the THC will really target anything that has to do with the brain, except for migraines. Those are inflammation. That's something else. And again, I'm talking on a human level right now, but it will apply to pets. And you need to understand these concepts when you're going to select something. So broad spectrum will work on anxiety, sleep issues, PTSD, ADD. Anything with brain is broad spectrum, or a CBD isolate, but you don't necessarily want THC when you're targeting those brain issues. Full spectrum is that whole plant in there. You took the whole thing and you put it in a Vitamix. Full spectrum products are containing the cannabinoids we talked about, CBD and all the versions, plus the THC and the terpenes, the waxes, flavonoids, all the other good parts of the plant. So many products out there will say full spectrum in the pet world. Some of them may say broad, and I just want you to understand that when you're going to buy a supplement, that you know what you're actually picking up, okay? Next slide. Now back to the whole hemp and marijuana thing. You see these pictures here. We talked about lemons and oranges. So they are all part of the cannabis family, but they're brothers and sisters. They are not duplicates of each other. Hemp is tall and lengthy. It can grow up to 10 to 20 feet. Around the world, it's used mostly for fibers and textiles, and then as a supplement. Marijuana, on the other hand, is short and bushy. It has very high concentrations of THC. Hemp is the opposite, very high concentration of CBD, barely any THC. In fact, it's less than 0.3%. So that's what makes hemp legal in the United States. The THC concentration is so low that they're able to sell it as a supplement, and you don't need that medical marijuana card as a human to get it, okay? There's no industrial application for marijuana at all. It's really grown for its psychoactive effect and for its medicinal benefits when they combine that THC and CBD together in that full spectrum product. Okay, next slide. So I like to think of it as a yin yang, and to me, this is a very simple concept. So the white part on the top with the little black dot, let's think of that as hemp. Hemp has a lot of CBD, which is the white, and a little bit of THC, that less than 0.3%. That is the black spot on the yin yang. The reverse of that is true for marijuana, where we have a lot of black, a lot of THC, and a tiny speck of CBD. Now, if you are familiar with the dispensaries, they will give you ratios. They will say this is a 5-to-1 concentration, and they'll break down how much CBD, how much THC is in it, because these are chemically altered when they make the product so they can get it. But for the nature's purpose, the way God made it, it's like the yin yang here. Okay, next slide. So how does hemp, marijuana, how does it impact well-being and feed our system? So before we start throwing around any more terms, I want you to understand that the body system is really no different than the thermostat in your house. So it used to be that we had a fire when we wanted to stay warm. And then technology advanced and we had air conditioners when we wanted to stay cool. And then we had a thermostat, which would regulate what was going on in the home and keep us hot when it was cold out and cool when it was warm out. And now technology has advanced to have even zones where we can have different temperatures in our body when we are working out. The room can be a specific temperature versus when we're bathing or sleeping. And so this system is very similar to the way our body works to regulate balance. Next slide. So believe it or not, our bodies are actually making a chemical that is feeding our balance system, just like that thermostat in our home. The body makes something called anandamide. And anandamide is very, very similar to CBD, THC, and all the cannabinoids that are in the plants, cannabis, whether it's hemp or marijuana. Anandamide is actually found in breast milk. So this is our body's way. It makes this chemical and it feeds something called the endocannabinoid system. Next slide. The endocannabinoid system is our largest self-regulatory system. And it is in our body. It is a real thing. This is not a fictitious concept or a theory. It's being taught, unfortunately, in only about 13% of medical schools right now. And I'm proud to say that my medical school, PCOM, is teaching it. But the endocannabinoid system is a real thing. Just like our circulatory system, our respiratory system, our nervous system, our body is depending on filling these receptors to create balance within. And so when we are taking a hemp supplement, we are filling these receptors. When someone's taking marijuana, they are filling these receptors and impacting the body's well-being. The next slide. So our body has different kinds of receptors within this endocannabinoid system. There's CB1 and CB2 receptors. The CB1 receptors are concentrated in the brain and the central nervous system, like our spinal cord. And the CB2 receptors are in the rest of the body, in the periphery. So in the skeletal muscles, in the immune system, in our organs. But there's a little overlap in the entire system. But generally speaking, CB1 are in the brain and the central nervous system. And the CB2s are peripherally located on the outside of our main nervous system. And they really have a lot to do with regulating our immune system and well-being. The next slide. So did you ever think, and it makes sense, that if we have this endocannabinoid system, would other pets have it as well? Would other animals? And it's true. It's not the same exact system. Just like if you would look in the inside of a dog or a cat, they have similar organs, lungs, heart. It's not the same as ours, but basically the concept is there that's very similar. And so our pets need to have their system regulated as well. So what happens when we're trying to regulate ourselves and maintain balance and we have not enough of that chemical that our body naturally makes? Well, how do we fill it up? So years ago, and I won't get into too much of the history, but back in the 1930s, they basically outlawed marijuana. They imposed a tax act on it that made it cost prohibitive for farmers to grow marijuana. And the farmers didn't fight back because they didn't realize that when they were prohibiting marijuana, they were prohibiting hemp as well. And the consequence of that was that hemp, which was growing in the fields, and the animals were eating it, and then we were eating the animals and getting our supply of cannabinoids naturally. When they stopped growing it, we lost that supply. And so our bodies became deficient. And so this happened to our animals too, in theory. Again, I'm not a vet, but in theory, the same thing that has happened to humans very likely could have happened to our pets. And so what can we do? How can we get that balance back? Well, we can get balance back by supplementing the system with something called a phytocannabinoid. So phyto, if you're familiar with Latin, means plant. Phyto is the plant-based cannabinoids that mimic our endo or inside the body cannabinoids that our body's making. I showed you that chemical compound. We're trying to kind of fake the body out, replace what we're missing, and get this empty tank fully functioning. So just like your car can't run without gas, we really cannot optimally function without a properly fueled endocannabinoid system. Next slide. So as I said, just as in humans, when our tank's empty, disease ensues. And so if our pets don't have what they need in this endocannabinoid system, in theory, they can have bad outcomes. And so what we're finding, again, anecdotally, because the research is limited in humans and it's way more so in pets, but there are benefits when we feed this system. And so we're finding that many dogs are responding, the little research I said, in seizures and arthritis, but also with nausea, gastrointestinal issues, sometimes with cancers, and the main focus of this talk of stress and anxiety. So it's not surprising that the same benefits that we're seeing in humans can be applied to pets. And so that pet that may be displaying its anxiety by pacing or drooling or panting or restless, this COVID pandemic has affected not only us, but our four-legged friends. They're developing symptoms, and thankfully there is potential that maybe we can fill a piece of this puzzle and help them out. Next slide. So the big thing I want to consider here with you and make sure you understand is that there's a dosing issue here and a composition consideration. So we're not going to talk about doses at all specifically, but just like I wanted you to understand the difference between full spectrum, broad spectrum, isolate, that's the composition, what exactly is in it. I want you to understand dosing as well. And one thing I didn't mention about the composition was that when you combine THC with CBD and the other cannabinoids, you get a very potent anti-inflammatory effect. So hemp, even though it doesn't have all of that THC, it does have less than 0.3%. And so that is enough to get that synergistic activity. But let's talk about dose. So THC can be very dangerous for pets. And this is something I can't emphasize enough. Again, anecdotal, I'm not a vet, but I can tell you that dogs in particular have a greater concentration of that CB1 receptor. And so when these cannabinoids enter their system and we're trying to target anxiety and we're trying to help, we really have to be careful about THC. Fortunately, there are hemp products out there that don't have THC in them. And the THC medically for humans is not as important as the CBD and other cannabinoids when we're treating anxiety disorders. And so we may not even need the THC for pets. May not. I'm not a vet. I don't say that with research behind me, but I can tell you that in humans, we really use broad spectrum products to target anxiety and brain issues. And so the same would likely apply in pets. So you may be better off with a broad spectrum product. Now, if you've bought a product for your pet and it's a full spectrum product, you may be saying to yourself, oh my gosh, did I just hurt my dog by giving this? If you bought a hemp product for your pet that was full spectrum, it's not likely that you're going to hurt them irreversibly. The THC concentration in hemp is so low, But I just want you to be mindful that too much THC can be very dangerous for pets because they have so many more CB1 receptors and they're so much more sensitive. The doses are way different for pets, and you can research the doses online. I'm not at liberty to give you recommendations, but I can tell you, generally speaking, it's lower. Pets usually have much lower doses of CBD and get benefit than humans. And if you give too much THC to a pet, if you have marijuana for some reason and you decide, oh, let me try it on my pet, I heard it's good. In theory, with too much THC, we can get this static ataxia, which basically you can see this little pup has this wide bait stance and kind of a daze. So they can get in this state where they're actually looking like they're standing up sleeping and they can't walk, and they can get toxic to a level where they actually vomit. And that's the real danger, is that if they vomit and they aspirate and get that material into their lungs, then they can die. And so too much THC not only would make them high, but also can make them vomit, can make them have this static ataxia, which can be lethal. And so we really need to be careful. If you're going to give your dog any product that has THC, I would recommend that you are doing this in conjunction with a vet that's experienced in this, because it's not something to play around with at all. Excuse me there, I lost my earbud. Okay, next slide. So now you understand a little bit more about the differences of cannabis, hemp, marijuana. You understand maybe you need a lower dose for your pet than you might have heard for humans. You understand that there's science here and you believe in benefit. Should we all just go down and buy some at Petco or Sunoco or wherever your local pet store is? Certainly not to out Petco by any means. I just randomly said that name. But should you go out and just buy the CBD that you see? I have to tell you, it's a real zoo out there. It's not regulated, and the supply that you're seeing for pets on the shelves is hemp-based because that's legal in the United States. Hemp as a supplement is legal to sell. But unfortunately, it's not regulated. So in the marijuana dispensaries, it's very regulated. And you can be pretty sure that what you're getting is what's in the bottle. But this is not true in the hemp world for humans and for animals. So no more would you go say, let's go have mimosas and go to the store and buy Tang. You wouldn't put that in a mimosas when you're having your friends over, right? You would have the good stuff. You'd make sure that you had high quality, freshly squeezed orange juice and nice champagne if you're having your friends over. So you're not going to go down the street and just buy any old CBD now that you think you might want to try this for your animal. Next slide. And so, what should we really be looking for here? So just like you would want to have the highest quality for your family, these pets are our family as well. I don't know if you're anything like me, but my pets are on my Christmas card. They end up in my bed. They are part of the family. And so I would consider anything that goes into their body has to be as good a quality as I want for my children and myself. So I can't emphasize enough to you to be careful of the products that are out there. So this being said, for my family, I chose to align myself with the company that had the highest quality CBD that I could find, hemp-based. Most of the humans that I deal with don't want to be high. They don't walk around. They don't want to walk around not functioning. They want to be highly functioning, just like you don't want your pets stoned. Okay, so we want to make sure that we're giving them the right formulation. So the first thing that I want you to make sure is that you understand the difference between triple lab tested and third party tested. So a lot of companies you'll see, they say we're third party tested. What third party tested means is that there is an outside company that looks at the product and says, yes, that has CBD in it, or that has whatever they're asking them to say it has in there. And I can't promise you that what they're saying is or isn't true. What I can tell you is that more importantly, you want to look for the word triple lab tested. Triple lab tested, as opposed to third party tested, means that at each checkpoint, there are 3 checkpoints for the CBD to be checked to see if it actually contains what it says. So when it's growing in the field, then when it gets packaged, and then when it gets sent out, there's 3 different steps, and it makes sure that it hasn't lost the concentration that it's claiming, no additives have been put in there, it's been checked for bacteria. All these things you have to make sure that the company you choose is triple lab tested. You also want to make sure you understand where the product is grown. Now, it almost goes without saying, but I will say it. You want to make sure there's no herbicides, there's no pesticides, that it's organic. Okay, organic is great and organic is important. I'm not saying it's not, but let's talk about biodynamic. Biodynamic is like the European value or the European model that is surpassing organic. And we do have biodynamic here in the United States, but you need to make sure that where it's grown is on biodynamic field that incorporates compost, incorporates live animals, that it's live soil where it's grown in. I'm not sure if you're aware, but hemp is actually planted in Chernobyl to extract from the land, to clean it. So can you imagine, if you don't know where this hemp is grown, you could have anything in that plant. It's cleaning the ground. So you want to make sure that the soil is extremely pure, and then that you're not putting anything in your body or your pet's body that you wouldn't ordinarily want in there. You're trying to make a healthy move, not add chemicals or damage to yourself. The other thing you want to make sure is that it's U.S. Hemp Authority certified. So there's very few companies that have this U.S. Hemp Authority seal on it. It looks like an H. I'm sorry, I don't have it to show you here. But you want to make sure you're U.S. Hemp Authority certified. The other thing is to look at the concentration on the bottle. So if you have a bottle in front of you, this is a helpful exercise. It will say certain amount of milligrams per fluid ounce. A good place to start is like 250 to 1,000 milligrams per fluid ounce. But it's not enough to say that. On that bottle, it has to say milligrams and then CBD right next to it. If it says 250 milligrams, CBD is floating somewhere on the bottom of the bottle, or 500 milligrams, and then a line later it says CBD, maybe it'll say some other things that they add in there. Be careful. 70% of the bottles that say they have CBD in them don't even have CBD, and it's scary. But like I said, it is a zoo. So focus on quality and make sure that the bottle that you've paid for and that you've selected to give your pet or your family has the word CBD on the same line as the milligrams. That's a quick way to spot a fake. What else did I want to tell you here? Okay, look for companies that are sold legally and that have full transparency. So, they have a website that gives you valuable information, and they have a customer service number to contact if there's a problem. You want to be able to find out, are they checking for different chemicals? Are they checking for lead, for mercury? Are they checking for different bacterias? So high quality companies will have certification of analysis on there. They'll often, a really good company will have a barcode on there that you can scan, and it will give you immediate access to the certification of analysis to tell you exactly when it was tested, what batch it is, what's in there, so that you know you're safe when you're taking it. And that's basically all the slides that I had prepared just to give you a rundown. So I'd be happy to answer questions, again, in the realm of not being a vet and the boundaries that I have. But certainly if you want to ask a question through Kelly or post it there on the tab, I'd be happy to do that.
So we did have a couple questions come in, so I wanted to get to those. A couple companies I just wanted to recommend, or at least another place to look is taking a look at the actual published studies through the veterinary schools. Cornell put one out based on osteoarthritis. They published that in July 2018. The company that backed that and paid for that to be done would be considered a probably pretty legit company. And their products would be one to look at as well. And then Colorado State also did another one on epilepsy. Both of them had very positive findings in them. The one on epilepsy, they did see a decrease in seizures in the dogs, with minimal side effects. The only side effects they found was diarrhea, which they contribute to dogs probably being more stressed out because it was at the school and not at home. And no side effects with the one on osteoarthritis. And they did find that dogs were significantly, is a quote from there, more comfortable with the CBD. It also may give more of a guideline on dosing as well, because they found what they worked as far as in those studies to produce results. So a suggestion would be to take a look at those if you're really interested in this and want to learn more information, but they'd be two good studies to take a look at. As far as some questions, so I have a question. I've had an excellent experience using CBD to help with my dog's arthritis. Is there something we could be doing to help change this absurd situation where vets can't talk about its benefits? Do you know if there's anything, any type of bill or something, that place where people can go to voice their love of CBD, make some changes?
Can you hear me? Can you hear me?
Yes,
okay.
I can. Yeah.
Okay. Now? Okay.
Yeah.
So I'm not familiar with that. As I'm not a vet, I'm not up on that, but I can tell you that there's a shift. It took a very long time for this to be accepted in humans. And so the trend is that more vets are available and interested and educated to talk about it. But I don't have that first degree information or first level information about any petitions you could sign. But I do think it's the wave, but Kelly is right. I mean, the vets are not permitted to talk about this. And it's going to take time. It's going to take time. And, there's a huge hurdle to overcome with the bad rap. That 5 years ago, giving your pets CBD was like reefer madness. You might as well inject them with heroin. Now it's more acceptable. And so we're making progress, but it's an uphill battle.
One thing, and I know that it's probably another thing that we can't talk about too much, and it's a little touchy with all that, but just wanted to mention that there is a concern, because this was one of the questions about someone's pet being on a certain medication and if CBD was going to interact with that. And you may have some more on the human end of it, but I know that there is a concern with knowing what it will interact with, and you should certainly talk to your vet about that.
That's right. So cannabinoids are metabolized in the human body by something called the cytochrome P450 system. So I imagine there's a similar system in pets. I don't have that information off the top of my head, but I can tell you that any medication that's metabolized by that cytochrome P450 system, in theory, can be altered by taking CBD. So for humans, the main class that's a big no-no is the anticoagulation, so the blood thinning agents. If someone is on a blood thinning agent, they should not take CBD because it could make their blood more thin. And they could take it. It's not like it's necessarily going to be lethal, but they'd have to monitor their blood levels so often that it makes it really not practical. So any medication that's metabolized by the cytochrome P450 system in humans is a major contraindication. Other things to consider for allergy is look at the additives that are in there. So a lot of the human formulations are in MCT oil, and I know the company that I'm aligned with has MCT oil in our dog line. And what the utility of that is it's a healthy fatty substance, basically. So a healthy fat will help to absorb CBD. It's best absorbed in a stomach that has some fat in it, not taken on an empty stomach if possible, but everyone has their unique tolerances for taking on an empty stomach or not. But with a fat in humans, again, maybe a couple almonds, some avocado, something that's a healthy fat source will help you absorb that better. And so they do put MCT oil in a lot of formulations. That is related to coconut oil. It's not exactly the same thing, but if your dog had an allergy to coconut oil, I would avoid an MCT oil. And that's, just a big no-no is that cytochrome P450, the blood thinning agents. In theory, you could make seizure medications altered, although they do use this for seizures. In humans, it's not a contraindication, but it's a consideration. We have to balance risk and benefits. So informing your vet, informing your provider that you're doing this is key to keeping you safe and healthy.
That kind of goes with another question that came up, and I can kind of go back to some of these studies with this, but what is the best means to give your pet CBD, which I know out there's creams, there's oil, there's capsules, there's treats. And one of the things that the studies, both the studies that were completed did was use the MCT oil. And that's what they recommended over all other options. They found that the results of its half-life and the results of what it was doing were all came best from doing oil rather than the cream or the capsules.
Mm-hmm. Yeah, and I would say, again, I'm referencing humans in this, and we're extrapolating to pets, but topical formulations are great for topical issues. So, if there's a muscle strain or a foot pain or a neck pain from being on the computer all day, then the topicals are great, provided that they meet that quality standard that we talked about, that we know where it's grown, we know, that it doesn't have any additives in it that are unhealthy for us. But topical issues can respond to topical solutions. But if you're trying to get arthritis or penetrate the brain for seizures in humans, the topicals aren't going to do anything. You have to take it and ingest it. Again, with that healthy fat source is the best.
And again, this is pet specific, but in humans, have they found that they build up a tolerance to CBD?
There is that noted in some people, not everyone. And it's definitely a concept overall that less is more. So we talked about the doses in pets being much lower in humans. So an average human dose, actually, I didn't want to discuss that because we're going to get too technical. But I would say, there's a such thing as building a tolerance to it. Mm-hmm. And, we have to adjust accordingly. So it's very individual and it's a trial and error kind of thing. But just because you take more doesn't mean it's going to work better.
The other thing I just want to bring up, so I kind of snuck in some secret vet talks who want to be unnamed, but some of the warning signs that your dog has had maybe too much or is not reacting well to CBD. Mm-hmm. Those warning signs include dry mouth, tremors, low blood pressure, they look dizzy or disoriented, or they are abnormally overly drowsy. They also gave some signs that your dogs had too much THC, if there's THC in it, which can include dribbling urine, walking like they're drunk or high, beginning to fall over while they're standing up. Again, low heart rate, low blood pressure, dilated pupils, and being easily startled. So those are things, if you are using CBD, to watch out for. And just signs that you should be aware of.
And Kelly, I would mention there when you said if you're using CBD. So you do have that safety net with the hemp that the THC is always going to be less than 0.3. But that being said, that is still THC, and we do have to watch for those signs. CBD has a much safer profile. Both of them are very safe. Like in humans, you would have to smoke 1,500 pounds of pot to actually overdose. And that would have to be done in 15 minutes. Like it's essentially impossible. Now, I don't know those types of stats for pets, but you're safer sticking with the hemp, I would imagine, because there's less than that 0.3 THC in there. But keep in mind those signs that you talked about. But the fortunate thing, and the thing that I love about hemp for my patients, is that the safety profile is so high. So as opposed to opiates, Opiates hit the brainstem. That's where we have our respiratory reflex to breathe and to take that breath. And when patients take too much opiates, they shut that system down and they forget to breathe. And that's how people die from opiate overdoses, whether it's heroin or Percocet or whatnot. Marijuana doesn't hit that. Marijuana, hemp, cannabis is working on that endocannabinoid system, on those receptors. It does not shut off your brain reflex. So the big fear, as we talked about, is getting so high that a pet would vomit and then aspirate and die as a consequence. So it may not necessarily shut the breathing down like an opiate, but a toxic level could make them have a consequence we don't want.
The one last thing I had for you, I just wanted to see, and so all of you guys know, I met Dr. Roman when I was working with her dogs, and we started this conversation. And you currently use CBD on your own dogs. So I was just hoping you could share a little bit of why, how, and how they're doing.
So I started my hemp journey with my mother, who had very significant pain and wasn't ready to get her knee replaced. And I was trying to find an alternative solution. And in addition to the opioid epidemic, it all kind of came full circle when I discovered that cannabis wasn't a bad thing. And then I began to say, well, we had a rescue dog who was very high strung, very anxious, lots of separation anxiety, really sort of intolerable dog to be around. And started to do some of my own research and said, well, let's try it. You know, the safety profile is high. And so we gave the CBD isolate, which is that bottom layer of the cake, just for the anxiety treatment. We weren't targeting anything inflammation wise or seizure, but for sure you notice a difference. And this happens a lot in humans, where people will take it for a month and they think, maybe I don't need this, and they stop. And we kind of did that with the dog. You know, we gave it, the dog was acting great, and we thought maybe it was just a tincture of time. The dog has really gotten adjusted to us. And as soon as we stopped it, we saw, okay, no, this is sort of an essential part of our routine. Which brings up another concept I would really recommend if you do decide to use hemp in your pet. In humans, we have to take this as a supplement on a daily basis. We have to get a steady state. We have to fill that system and then continue feeding it. So as opposed to marijuana, which you could take and it has high THC in it and you get that immediate effect, hemp doesn't work like that. You're not going to feel that you're taking it. Your dog probably won't notice it in one dose. But if we build that steady state, that's when we get the benefit. So in humans, it can take up to 6 weeks. Some people notice symptoms in a couple days, but it could take 2, 6 weeks, up to 3 months to even get the impact. And that's on a regular dosing. So this is something that you take every day, and you don't take it only when you need it. It's not a sleep aid or an anxiety aid in the moment. So you could up the dose, but you wouldn't want to turn on and off the dose as far as feeding that system. And so similar, in theory, would apply to pets.
And can you just go over some of the ingredients you may see that in a product with CBD that is potentially dangerous, or going to be a sure sign that something is not right with that CBD?
I would say you really don't want anything in there. You want CBD by itself. I mean, MCT oil, I'm okay with. If they add some anti-inflammatories, and again, I'm talking about humans, but if there's turmeric in there or willow bark, some extra herbal therapies in there, I'm okay with that. Words I can't pronounce, I'm not okay with. Very focused on where it's grown, but also if you know where it's grown, those products that are grown where you would want, that are biodynamic, that don't have herbicides, pesticides, that are organic, most of them are not going to add a lot in there. You know, these fillers sometimes can be for humans, like melatonin. Melatonin is $10 a bottle. Melatonin is a sleep aid. It works for some people. It doesn't work for everybody. But if you're buying a product that doesn't have the specifications we talked about, you could be buying a big bottle of melatonin with a couple drops of CBD. So you want to know exactly what the concentration is in there and really go purest as you can. If you can't pronounce it, you don't use it. MCT oil and the cannabinoids is really all you need in there.
Okay. And kind of going back to that, you know, some specific research that I kind of pulled out from one of the studies, you had mentioned 70% of CBD products were wrongly labeled.
Mhm.
Some more detail that I saw in one of these studies was 43% of CBDs had more than stated, and 26% had less than stated, and that's after a 10% variation, allowing for a 10% variation. So look into a good company. And you want to share your company again? I'm going to post your information,
Yeah.
contact information
Mhm.
at the end of this so that everyone has it. So please feel free to refer back to that.
Sure. Before I hit on that, you reminded me of something. So you may see hemp seed and hemp extracts in there. Seed, I say seed. If you see seed in the ingredients, it's like, see you later. You don't want seed. You can't get tomato sauce from a tomato seed. You can get it from a tomato. You don't want to get the products that are seed. They can use the seed extract as their vehicle to transmit the supplement. So it could be in hemp seed extract, but it has to have the actual cannabinoids in there because you're not going to get the therapeutic effect from the seed. So I think that's also an important ingredient we talked about. And the company that I work with is called Canaway. It's the premier hemp company in the United States. It was basically the one that is in the physician's desk reference. That's why I aligned myself with it. It is the only hemp supplement company that is in that book. That's basically our physician's Bible. The prescribing digital reference used to be called the physician's desk reference. So we are the only hemp that is in there that is a plant-based hemp. And it just meets the quality standards and is really setting the standards for the industry when there aren't none. So it's called Canaway with a K, and Kelly can give you the information. But they do have a dog line. They have some cat treats. They have a dog oil, and they have tons of human products, obviously. So you do not need a medical marijuana card to get a hemp product because now you know that they're not the same thing. So hemp is legal in the United States. You can get this Canaway product through a distributor like myself. You should not be able to find it on Amazon. If you do, I'd like to know about it. That's against the company policy. It's a very high grade. To me, it's like the caviar of hemp. So it's a very, very fine quality with great results. And I'd be happy to help any of you kind of troubleshoot this, knowing that this is a supplement. We're just doing this, to try to help, but this is not a prescription. This is not medical advice when we interact with one another, really just trying to help and promote awareness and use this supplement to try to help.
So we did have another question, kind of what you were talking about, being the premier U.S. company. Is U.S. grown hemp a place where you want to see it's grown on a label?
So I wouldn't blanket statement and say no, but Canaway is not grown in the United States. It is grown in Austria and in Holland. They have several fields over there that they investigated and checked the soil quality and had 5 generations of crops going through before they felt that the quality was there. So the problem in the United States is, we've sort of damaged a lot of our soil. So I can't speak for all the US products. I'm sure there's some good ones out there, but when you go outside the United States, sometimes you get higher quality products and different things. It's just the way it is. Our gluten source is different than it is over in Europe, and a number of different things have different qualities. So just take a close look, make sure you know where it's grown and what was on that land before they grow it if you are considering a U.S. source. Yeah.
Well, one other thing I just wanted to see, I see some of my dog training people are in there. I want to throw out some things that I've personally had my clients using CBD for. And any of you guys listening out there, if you want to kind of throw out some different things that you've had your clients using it for. I know I have had clients who have had, and these are anecdotes again, no scientific behind it, but just to share, dogs moving when they're moving homes and the stress that it goes on with moving. I've had people report great feedback on that. I have people who use it specifically for anxiety and some fear aggression as well. when dogs overreacting, when people come over, to mellow them out and take some of that edge off. Everybody reports that the dog's personality does not change at all. You just see kind of that edge going away. So any of you guys want to throw anything out there? But think about the anxiety. It's going to really help with the separation anxiety. That's kind of why we started talking about all of this. While you go back to work, it may be an option for some of you to help the dog kind of take the edge off and allow some of the separation anxiety to go down a bit. So think about the different ways that you could use it. But thank you, Dr. Roman. Yeah, very informative. I appreciate all your help. A lot of that I had no idea about, and it was very educational.
Great.
So I'm going to throw up your card, and that has your contact info on it. You can purchase any products from your website, right?
Yeah, you can. If you have my business card, I think, I don't know, you could show it, but my link has changed. But they can contact me on Facebook through Mainline Pet if you'd like. I'm happy to, have a consult on the phone with you and take you through the best treatment plan, especially targeting what your pet's needs may be, or even personally, if you're interested.
Then there was a comment, just so you know, thank you for busting some myths and clearing up some misconceptions. So I appreciate that a lot.
Good. Glad to help.
And we just had, that person who commented, I'm going to also share because a great resource for any of you dog owners out there. I would highly suggest going to Concord Pets, talking with Sarah Davidson. She's very well versed in the different lines that they carry. So it's another, talk to an expert wherever you're looking at buying this. Amazon's probably not the place to buy CBD anything, or other places online. So talk to a specialist in it. That's kind of the best advice I could get. You can certainly ask Dr. Roman, but talk to someone who knows what they're talking about versus a salesperson. And thank you very much. Thank you, everyone who joined us. Have a wonderful night. And I will put this back up here for anyone who wants to see it. And thank you again, Dr. Roman.
You're welcome. Stay safe, everybody.
Bye-bye.
Bye-bye.
There you guys go. I'll leave it up for you, but thank you all for coming. And have a wonderful night. Next week, we will have Christine Egbert. She's talking on puppy socialization, puppies in the pandemic. So we're excited to have her as well. So look forward to seeing you guys next week. Thanks.